Hello, my name is Joshua Brown from the expert interview training company howtobecome.com, and in this presentation I will teach you how to pass your NHS ICU Nurse job interview. So if you have an interview coming up with any NHS trust or hospital, then please make sure you watch this video from start to finish, because I promise to help you to stand out and succeed. To achieve that goal, I'll start off by giving you a list of NHS ICU Nurse interview questions that I strongly recommend you prepare for. I'll then provide you with example high-scoring answers to those questions to help you to succeed. Plus, I'll also make sure to give you some essential tips for passing your NHS ICU Nurse interview before finally telling you how you can instantly download these slides plus 30 great answers to NHS ICU Nurse interview questions in a PDF guide. And just very quickly, please don't forget to subscribe to my channel, because I want to help you to pass your interview by giving you brilliant answers to the toughest NHS ICU Nurse interview questions. And I can only do that if you are subscribed. And please don't forget to hit that like button, because this tells me you find these tutorials useful. Oh, and don't forget to tell me the name of the NHS trust that you're applying for, so I can get back to you with even more tips and advice. Okay, let's take a look at that first interview question. Tell me about yourself. Now, this is a brilliant opportunity to get your interview off to a flying start and really impress the hiring manager. You can be the standout candidate by focusing your answer on the skills and qualities that you have. Do not talk about your home life or your personal life unless it's relevant to the job role itself. Focus on your relevant work experience and your relevant academic experience and your passion for working in the role as a nurse for the NHS. Make sure you mention in your answer how you're going to add value to their team in this role as well. How are you going to add value to the NHS in this job role? Now, a really simple and easy way to do all of those things I've just mentioned is to make sure you study the job description in detail before your interview and tell the hiring manager how your skills are a perfect match to those that they desire. So for example, if on that job description it states they're seeking someone who has a patient-centered approach, someone with great communication abilities, then throughout your NHS ICU Nurse interview answers, be sure to use those exact terms and also back it up with examples of where you've previously demonstrated those skills and qualities. So let me now give you a brilliant top-scoring answer to help you. Tell me about yourself. Thank you for inviting me to interview for this position today. I am a dedicated and compassionate nurse with solid experience working within the NHS across various clinical settings. While I haven't specifically worked in an ICU, I've developed strong skills in patient care, prioritisation and effective communication. My experience has equipped me to handle high-pressure situations and deliver high-quality care, which I know are essential in an ICU environment. Working within the NHS has also given me a deep understanding of the importance of teamwork, attention to detail, and emotional resilience. I am eager to apply my experience, continue learning, and make a meaningful difference in the care of critically ill patients. Now that is a powerful way to kickstart your interview and be the standout candidate. Remember, by giving a confident answer like this to the opening interview question, tell me about yourself, not only will you impress the hiring manager, but you'll also gain confidence in the rest of your answers to come. Okay, let's take a look at the next nursing interview question. Why do you want to be an ICU nurse? Now, this question is being asked to assess your motivation and understanding of the unique challenges of ICU nursing. Make sure in your answer you emphasize your passion for critical care, the complexity of the role, and your eagerness to develop specialized skills, linking it to your own NHS experience. So here is a brilliant top-scoring answer to help you. Why do you want to be an ICU nurse? I want to be an ICU nurse because I'm passionate about providing care in a challenging and rewarding environment. Having worked within the NHS, I've seen how crucial the ICU is in supporting patients during their most critical moments. The complexity of care, the need for quick decision-making, and the opportunity to make a real difference in patient outcomes really inspire me. I'm drawn to the ICU because of the close patient monitoring, advanced skills required, and the chance to work as part of a highly specialised team. I'm eager to further develop my clinical skills, take on new challenges, and contribute to the excellent care that the NHS is known for in its critical care units. Okay, now don't go anywhere as I still have plenty more interview questions and answers to give you in this video, but when you're ready, and only if you want to, click that link in the top right hand corner or in the pinned comment below the video. It will take you through to my website, howtobecome.com, where you can download my top 25 NHS ICU Nurse interview questions and answers to give you the edge in your interview. Okay, let's take a look at the next question. What experience do you have which is relevant to this NHS ICU Nurse position? Now, this question is being asked to gauge your clinical background and how your previous roles align with the demands of ICU nursing. In your answer, focus on your relevant NHS experience, your clinical skills, and your ability to handle acutely ill patients, while mentioning certifications that prepare you for ICU work. Here is a brilliant top-scoring answer to help you. What experience do you have which is relevant to this NHS ICU Nurse position? I hold a nursing degree and have gained valuable experience working within the NHS in a variety of clinical settings. My journey has included not only completing my nursing degree, but also obtaining the necessary certifications such as my NMC registration and additional training in advanced life support, which I understand is essential for critical care nursing. Through my roles, I've had the opportunity to work with acutely ill patients, often in demanding environments where quick decision-making and the ability to manage complex care were crucial. Although I haven't worked directly in an ICU, I have consistently built on my skills, such as administrating medication, monitoring patient conditions, and collaborating with multidisciplinary teams. My ongoing commitment to professional development has prepared me for the transition to ICU nursing. I'm now eager to apply this knowledge, learn the specific complexities of critical care, and contribute to the high standards of care expected within the NHS. Okay, here's another question for you. How do you communicate with critically ill patients and their family members? Wow, that's a really tough question. And it's being asked to evaluate your communication skills, particularly under stressful circumstances with vulnerable patients and families. In your answer, you must show empathy and clarity in your approach. My advice is to emphasize your ability to simplify medical information and provide emotional support while maintaining professionalism. So let me show you what I mean by giving this top scoring answer to help you. How do you communicate with critically ill patients and their family members? When communicating with critically ill patients and their families, I prioritize empathy, clarity, and active listening. For patients who may be unable to speak or respond, I use non-verbal cues like facial expressions, body language, and simple gestures to ensure they feel heard and cared for. With families, I ensure information is delivered clearly and compassionately, avoiding medical jargon and allowing them time to ask questions. I understand that they are often under immense stress, so I aim to provide emotional support and reassurance while keeping them informed of their loved one's condition. Building trust through open, honest, and compassionate communication is essential in these situations. Now, in preparation for your NHS ICU Nurse interview, I also recommend you prepare answers to the following questions. What would your colleagues say about you? What experience do you have which is relevant to this ICU Nurse position? How do you keep organised in your current position? What makes you a good team worker? How do you keep up with the latest developments in nursing? How would you handle a difficult patient? What are your short and long-term goals? Why do you want to work for us? Why do you want to leave your current position? Can you think of a time when you would break protocol or procedure in a clinical setting? Why do you want to work in the ICU department? Why should we hire you? Now, they are just some of the questions that you should be preparing for. But if you want to get the full list of all 25 NHS ICU Nurse interview questions, or if you want to accelerate your learning even further to pass your interview at the first attempt, then click that link right now in the top right hand corner of the video or on the pinned comment below for two reasons. The first reason is it will take you through to my website, howtobecome.com, where you can get all of these answers we just covered, plus a total of 25 brilliant responses to ICU Nurse interview questions in a PDF guide. And secondly, the next reason is I've given you plenty of NHS ICU Nurse interview tips and advice on that page. It's a brilliant resource, guaranteed to help you prepare effectively for your interview and also, more importantly, put you ahead of the competition. Make sure you check out that link. I hope you've enjoyed this tutorial please don't forget to subscribe, as I'm on a mission to help as many people as possible pass their job interviews, and I can only do that if you are subscribed. Please also hit that like button, as that encourages me to make more videos just like these. If you have any questions regarding any specific job role or NHS trust, do let me know in the comment section below, where I'll get back to you with even more interview tips and advice. And finally, don't forget to connect with me on LinkedIn. I've put my LinkedIn link in the description below. It's always great to connect with like-minded professionals such as yourself. Thank you so much for watching. I wish you all the best with your NHS interview. Have a brilliant day.